Hello friends, so this is a post of care or post of nursing management of our carbuncles. So this patient was presented with severe, we can say, abscess present over the back of the you can say body, and we did the IND incision and drainage of this abscess, and that is called as a carbuncles. So normally at where the hair follicles, where the hair is present, the infection is called as the initially the folliculitis, and if the infection get deeper, that is called as the furuncles, that is called as also called as the boils. And suppose that furuncles or boils get become multiple, or multiple hair follicles get affected, that is called as a carbuncles. Okay, so two or more than if you can say furuncles is present, that is called as a you can say carbuncles. So you can see in the diagram also the severe abscess, you can say erythema, redness, and you can say painful area of the body of the you can say of the lesion, where we need to do a kind of IND to drain out the abscess. And if suppose we have to start the, you can say, antibiotic after the OT and all. Okay, so you can see the dressing, how we are performing or how we are doing. So the senior most in charge of our ICU is performing the dressing. So you can see very neat and carefully he is performing the dressing. He is washing the area. We have drained all the abscess. Okay, so the area should be cleaned regularly. We have to do the regular dressing. Okay, otherwise the area become again infected. So along with that, this regular dressing, we need to do a kind of, we need to continue our you can say oral antibiotic also. Okay, so this is a case of carbuncles. If it is case of folliculitis, or you can say जो normally skin infections जो रहते हैं, skin infections जो भी रहते हैं, पैथोजेनिक जो बैक्टीरियाज लाइक स्टाफिलोकोकस ऑरियस वगैरह जो बैक्टीरिया होते हैं, वो folliculitis लीड्स टू फुरंकल्स, लीड्स टू कार्बंकल्स, ऐसा कॉज करते हैं. इफ सपोज फॉलिकुलाइटिस हुआ है एंड लोकल एंटीबायोटिक से ट्रीट नहीं हो रहा है, तो ओरल एंटीबायोटिक देंगे. ओरल एंटीबायोटिक से ट्रीट अगर नहीं हुआ है, तो वी हैव टू कंसिडर दिस इज कॉज्ड बाय द वायरस, फंगाई एंड पैरासाइट्स. ओके, सो द मेनली और you can say the 75%, more than 75% are the skin infections caused by the gram positive bacteria, staphylococcus aureus and all. But there are you can say number of infections, you can say that there are you can say few infections. If it is not treated with our antibiotics, then we have to consider it is caused by our kind of you can say virus, fungi and bacteria, virus, fungi and parasites. Okay, so you can see the neat clean dressing we are performing here, and we are applying the micropore here. We have you can say smeared the gauze piece. We have kept the smeared gauze piece with betadine, with hydrogen peroxide, with one more solutions. Okay, and ultimately we kept that smeared gauze piece into the area, and we packed the area with our gauze piece and gumji pads, and we again doing the upper part dressing with the micro